In this video, we're going to understand what eczema is so that you can deal with it effectively. Before we get started, let's begin with some definitions. Most people with eczema actually have atopic eczema or atopic dermatitis. Being atopic really means that you're particularly sensitive to your environment. That sensitivity explains why a lot of people with eczema also have asthma and hay fever. Some just have one, others have all three. The unique thing about eczema, however, is having really dry skin. Having atopic eczema means that you'll always be vulnerable to acute eczema. This is the severe, short-term flare-ups that you'll be used to and can be separated from your longer-term baseline eczema. That is chronic eczema, the long-lasting damage that never quite seems to heal, and this stuff is entirely avoidable. This is probably the single most important point in this video. There's nothing special about chronic eczema, it's just acute eczema that's scratched. If you don't scratch the acute eczema, it will never develop. Scientists have even carried out tests using robots to scratch normal skin, and after a while, it becomes exactly like skin with chronic eczema. So this shows that any skin will look like it has eczema if it's scratched enough, but also that your skin can look normal if you learn to control your scratching. You'll now understand that what you think of as eczema is probably a mixture of acute and chronic eczema that can be separated into three different levels. The first is dry skin. Moisture escapes your skin easily, making you more prone to flare-ups. When you do flare up, you get level 2, eczema, and the itching that comes with it. Because you're itchy, you scratch, which is level 3. This damages the skin, making it more dry and turning acute eczema into chronic eczema and more itching. This is the vicious circle that you're probably super aware of and desperate to escape. The good news is that you can escape the circle by targeting each level with the appropriate treatment. You treat level 1, the dry skin, with moisturizers. Level 2, the acute eczema, is dealt with topical medication like steroids or Protopic. Level 3, the scratching, is managed with habit reversal, registering and controlling your scratching to allow your skin to heal. For the duration of this program, you're going to need to get really serious about your medication, figuring out what's going to work best and using it the recommended amount. This might be much more than you're currently used to. A lot of people want to wean themselves off steroids as quickly as possible, but you're going to need to use them a little while longer if you want to accomplish long-term change. Treating your skin with the right medication for a few weeks now will save you a lifetime of a little bit of medication here and there. So be prepared to look at your medication a little differently while you're taking part in this. This would also be a good time to visit a doctor or dermatologist to ensure that you have what you need. Moisturizing the right amount is really important. Properly moisturized skin is less likely to flare up, and when it does, it will be less severe. This is why it's good to think about moisturizer as a tool to stop skin drying in the first place, rather than just a treatment for dry skin. You should be moisturizing throughout the day, and ideally, straight after washing. You may need to use it once an hour, maybe just a few times a day. What's important is that you get used to doing it whenever your skin feels like it might be getting dry. Find a moisturizer you like and make sure you always have some to hand. You might want to transfer some of your favorite stuff to a small container so you can carry it with you wherever you go. There's a massive variety of moisturizers, lotions, creams, emollients, and you'll have to experiment to find whichever works best for you. Now, these are the medicated eczema treatments, either your steroids or perhaps Protopic or Elidel. You might be fed up with using these and keen to get off them as soon as possible, but for the program to work, you do need to use them one more time to kick the eczema for good. Typically, you'll have different medication for the sensitive skin on your face to what you use on the rest of your body, and during a reaction, you may be using it twice a day. Talk to your doctor to make sure you're using the correct medication and understand when you should be taking it. Intensive use for a few weeks to clear up the eczema will reduce the likelihood of it coming back and mean you can use far less in future. You may have got used to putting on a bit every day for several years, and that's going to stop with this program. One really important point that most people aren't aware of is that just because your skin looks healed doesn't mean it really is. There are layers of skin beneath the upper visible layer that also need to recover. So some doctors recommend continuing treatment for 2 weeks after this look good point to ensure that it's really cleared up so hidden healing can occur. and depending on how bad your flare-ups get, you may need some extra help to deal with the reaction. Flare-ups might have your skin feeling like it's on fire, or make parts of you unbearably itchy. The evidence around antihistamines isn't totally clear, but some people find it helps reduce their itchiness and calms their flare-ups. Have a chat with your doctor if you think this would help you. So, you should now understand the 3 levels of eczema, how you deal with each, and why steroids are an essential part of your treatment, but not the whole story.